Thank you. Pleasure. Please have a seat. Um, we've been working on some research together over the last sort of 6 months. I quoted a little bit of in the opening, and I'm going to be talking a little bit about it here today. I think we're going to draw it on it during the day here today. One of the things I sort of talked about in my opening was that the demand for healthcare across the region is really growing and increasing. And there are a bunch of reasons sort of behind this and some implications of this. One of the things we're seeing, and we saw this from the research, is that one of the main sources of lots of main forces of confusion and frustration for people trying to navigate the healthcare system across the region. And we're not just talking about Singapore here, we're talking about across the sort of the APAC region here. What are you seeing as those main sources of confusion and uncertainty around the region?
Yeah, thanks for the question, Charles, and good morning, everyone. Great to be here, and thanks for the opportunity. Yeah, we're very excited about the work that we've been doing together on this patient voices research, because I think it's absolutely critical that we put the patient at the heart of everything that we do, and therefore we need to really understand how patients are experiencing healthcare. And the reality is the outcomes are quite shocking. Yeah. When you look at the research, 8 out of 10 people actually says that they are delaying care for a number of different reasons. Yeah. Because healthcare is confusing, it's difficult to understand where to go, people are worried about cost, people are worried about putting burden on their loved ones. So 8 out of 10 people is postponing accessing care, and that's a real problem. It's a problem at an individual level because ultimately when patients postponing care, it means that a condition that could have been treated quite quickly and easily has the risk of becoming a crisis, like a health crisis. So that's very concerning at an individual level. Not to even mention the fact that as people are postponing or delaying care, it generates a huge amount of anxiety and fear because people don't really know what's going on. They know something is wrong, but they don't know exactly what's going on. So at an individual level, that's something we really have to make sure we avoid. At the same time, it's also a problem at a macro level, right? Because if at a mass scale people are delaying care, that means healthcare ultimately becomes even more expensive because again, these conditions turn into health crisis. Yep. That puts even more burden on the healthcare system, right? And that ultimately means that healthcare becomes less affordable and less accessible for everyone.
Yeah, on the accessibility front, that's clearly a reason why people are delaying care. Yes. It's just hard sometimes to see a doctor. Often from our research, sort of in Indonesia, sometimes people waited a whole day to see at a medical center to see a doctor was one of the top of the list of their gripes there.
But Charles, even here in Singapore, right, where we typically think, well, the healthcare system is very clear and understandable, 60% of people surveyed in Singapore actually says that they're struggling to access healthcare. Yeah. They don't know where to go. They don't know how to book an appointment. They don't know what good care looks like. They feel like they don't have the right information to make well-informed healthcare decisions. Yeah. So there's a huge amount of work to do to remove some of those barriers.
Yeah. Any suggestions on how we can remove those? I know some of the issues, the sort of structural changes in sort of the healthcare system. It remind me a little bit of the retail segment, sort of, I don't know, 10, 20 years ago, where our shops were only open 9 till 5, because that's convenient for retailers, but it is not convenient for shoppers, because lots of them are working during that time. We're seeing something similar in the healthcare sector as well, which are only open during working hours, potentially not open on the weekend. Any ways we can address that?
Yeah, so maybe take a step back. So I think there are 3 broad categories of reasons why the healthcare system is not working for patients. Yep. I think the first one that you called out is accessibility. So people don't know where to go, it's inconvenient. Here in Singapore, a lot of people say, I want to go and see a doctor, but I can't leave my job. I'm worried about, stepping away from work. So accessibility is a big challenge. The second big challenge is really around cost. So people are very worried about the cost of healthcare. And 1/3 of all of the patients that we surveyed actually says that healthcare was more expensive than they had anticipated. So
Yeah,
that's a
shock.
huge challenge
Yeah.
as well. And then thirdly, I briefly mentioned this already, is around information. So people don't feel like they have access to the right information. So
Yeah.
let's take them one by one, right? So if we talk about accessibility, yeah, all have a role to play to make healthcare easier accessible. From a Prudential perspective, we work really hard to try to guide patients at every step by making it easier for them to understand where to go, to help them book appointments. We have built a network of priority healthcare providers here in Singapore, but also in all of our other Asian markets. Healthcare providers that we partner with, that we know, that we trust, that we believe are able to give the patient the right care, but also in a cost-efficient way, because we haven't even talked about medical inflation yet. That's another important topic. So we will be doing a lot to guide patients to the right care at the right place at the right time, but also at the right cost, giving them the right information, giving them the right tools.
Yeah.
Because we believe that's a responsibility that we have towards the patients that we serve.
Does that look different for different sort of demographics in society? Younger people, older adults within? Is it
Well, I think
delivery good? Are you thinking about a post-app world, which Colin was talking about earlier?
Yes, well, absolutely. Listen, I think when we think about the patient experience, and by the way, we've made an intentional decision at Prudential to put the patient experience at the heart of our health strategy. So some of our competitors, are very focused on lifestyle management and wellness and counting the number of steps that you take and giving you free coffees or gym memberships.
That's what I get, actually.
Yeah, we don't do that. We don't do that. And it's very intentional because we believe that by focusing on the patient experience, that's where we can make the biggest difference in the lives of our customers. Help when you need it most. That's when you become a patient. That's when you need help. Not counting steps, not, all of that is nice to have, but it's not essential. So again, we believe that patient experience is absolutely critical, and it has to be digitally enabled, but it's not a digital experience.
Yep.
It's digitally enabled. In other words, we want to give people the information and the tools at their fingertips. And yes, you will be able to book an appointment with a provider through the Prudential Health Concierge that we're going to be offering all of our health customers across the region. But at the end of the day, technology is never going to replace actual physical interactions in the healthcare space. So we need to make sure that we build those journeys in such a way that they accommodate that. And to your point, they need to be tailored to the specific audiences. In the previous conversation, you talked a little bit about that. Apps are not for everyone.
Yep.
And by the way, I agree with the fact that AI offers tremendous opportunities to move beyond apps. I like to think that it's a little bit of a sidestep, but apps are a construct, makes it convenient for companies to bring services together in a certain place. But it's not necessarily convenient for customers.
Yeah.
Right? So yeah, I think there's huge opportunity there.
We are seeing, and we saw this in the research as well, that there is staying on the AI topic. Lots of patients, lots of people across the region are really drawing on AI as their first point of information about healthcare stuff. Diagnosis, ChatGPT or one of the other LLMs around diagnosis being a first and sort of foremost type of solution. Does that concern you? Is that something you can bring into a safer environment, or how are you thinking about that?
Yes. So again, back to the three key reasons why people are delaying care, right? Access, information, and cost. So on information, you're absolutely right. 55% of patients is saying, I do not have the right information to be able to make well-informed healthcare decisions. And in the absence of right information, people turn to Dr. Google. People turn to AI. 40% of people actually uses AI and other digital tools to get healthcare information. Now, that does concern me somewhat, because where's that information coming from? Is it actually clinically valid and solid, right? Is it the right information for people to base very important healthcare decisions on?
Yeah.
So yeah, we believe at Prudential, we have a big responsibility to curate that information in such a way that we can offer it up to our patients, give them the right information so that they can make better informed decisions. We're never going to tell patients what they should or should not do. We're not doctors, we're not clinicians. That's not the role that we want to play, but we do want to make sure we offer people curated and information and data that we know is actually clinically valid.
Yep.
And proven, so that again, patients feel empowered to make the right healthcare decisions.
We have people here from sort of across the region, so thank you everybody for coming to participate, but they will know that having the right sort of language and cultural context for these apps, for this information is super important. It's not about sort of creating something in English, translating it and dumping it into a new market. How do you deal with that?
Well, we deal with that by first and foremost acknowledging that healthcare is highly localized.
Yep.
Right? So every healthcare system is different. Healthcare consumers, are different in the way they interact, they operate, they want to access healthcare. So from where I sit in a global world, being responsible for the health business of Prudential across the region, we're very mindful of the fact that we always start with what's required locally.
Yep.
And then work backwards from there to see, are there capabilities that we can build across the region that can benefit everyone. So yeah, that means really understanding the patient needs at a local level, which brings us back to the reason why we've done this research together, right? And yes, there are some interesting regional patterns and consistency in the findings, but there are also very specific local nuances that I think we address. We were just talking about information.
Yep.
Yes, people turn to AI, but it's interesting, in Singapore, people actually still very much turn to their GP and to their specialist to get the right medical information.
Yep.
So there are clear differences between the different markets in Asia.
Yep, absolutely right. That research, I'm going to shortly, I'll show you a QR code for it so you can read it. I'll do it at the end of the session. This is based on a big survey, patients across the region, some really interesting insights. We've sort of done it justice, I think, in our discussion a little bit. We've only got a couple of minutes left. I want to ask you a final question. It's sort of forward-looking. Considering the things we've discussed, this need for healthcare to be more accessible, to be more patient-centric, all of these critical things, what's sort of that one main, if you can put it into one main action that we should, as a community, be focusing on to try and address that accessibility, patient-centricity piece?
Can I give two?
Yeah? We've got time. We'll give you two.
Okay.
You can prioritize that.
Because the first one is more of a I think a more philosophical point, which is, if you want to put the patient at the core of everything you do, and I believe everybody in this room wants to do that, then you have to first and foremost know the patient and understand the patient and listen to the patient. So yes, please do download the Patient Voices report, because it's incredibly powerful insight that I think we should all reflect on. Action, what do we really need to do? I think for me, a very, very important part of that is clarity. We've spoken about access to care, we've spoken about information, we haven't really spoken about cost. And again, that's the third broad category, right? The reasons why people are delaying care, postponing care, is because they're worried about cost. And there's a lot that we need to do to keep the cost of healthcare under control. Probably a different conversation for a different conference. But if nothing else, we need to take the surprise out of the cost, because people are worried and anxious because they don't know what to expect. So for me, this is really all about clarity. How do we create more clarity around the cost of healthcare? How do we make sure that when people step into that hospital, visit that doctor, they already know? They know what it's going to cost. They know what's covered through their insurance. They know what their out-of-pocket expense is going to be. That will remove so much worry from the patients, and therefore remove another important reasons why people are not seeking the care that they so desperately need today.
That's a good point. I guess the extension of that is that when they do have to pay, the reimbursement of that is an easy, low burden sort of.
Well, and that's where we come back in as an insurer, of course, and we need to make sure that we create a worry-free and hassle-free claims experience.
I don't think my insurer is worry-free or hassle-free.
No, listen, and I think insurers have a lot to do, including Prudential, right? I mean, I will hold my hand up and say we're definitely not perfect. But we are investing significantly in this, again, using AI as an example. So we're implementing AI that allows us to very quickly assess medical claims, to read very complex medical reports, very detailed medical invoices, and do that much quicker than a human would be able to do that, to support our claims assessors, not to replace them, but to support them, so that they can make claims decisions faster and more accurately. And that ultimately means money in your bank account quicker. And again, that's another worry that we're removing for the benefit of our customers.
Excellent. You're painting a very positive picture of the future here, and I'm really sort of looking forward to that. Improving access generally for people across the region is so key and so important. And maybe we'll have another event. We'll focus on the cost element of it, or maybe there's a panel a bit later today for us to talk about that as well. Really fascinating. I think I saw the QR code for the report go on the screen behind me. There it is again. Please do take advantage of that. Read it. Have a look at it if you can. If you're around for the day, maybe people can hit you up and have a conversation about that as well. Please do get involved. I think we've got a coffee session coming up in a few more sessions time. Thank you very much. It was fantastic. Please join me in thanking Ian for the discussion here today. It was fantastic. Thank you very much.
Thank you.
Excellent. Thank you for joining us.